Unit 1. Introduction to Health and Illness. Factors influencing health. Determinants of health. Many factors influence an individual's health status, health beliefs, and health practices. These factors can be categorized into internal and external factors, some of which may or may not be under the individual's conscious control. To provide holistic care, nurses must understand how these factors influence behaviors in both healthy and ill patients. Internal factors influencing health. Factor type. Subfactors. Examples. 1. Biological factors. Genetic makeup. Age. Gender. Ethnic origin. Developmental stage. Sickle cell anemia, genetics. Infants prone to infections, age. Osteoporosis, gender. 2. Psychological. Mind-body interaction. Emotional reaction. Self-concept. Anxiety before exams causing diarrhea. Depression after diagnosis. 3. Cognitive/intellectual. Knowledge level. Educational background. Health literacy. Diabetic youth ignoring diet despite knowledge. 4. Spiritual. Religious beliefs. Personal values and meaning. Hope and purpose. Refusal of blood transfusion due to religious beliefs. External factors influencing health. Factor type. Subfactors. Examples. 1. Physical environment. Sanitation. Ventilation. Pollution. Water quality. Contaminated water causing illness. 2. Biological environment. Bacteria. Viruses. Fungi. Flu outbreak in community. 3. Psychosocial environment. Relationships. Workplace stress. Lifestyle. Marital conflict affecting mental health. 4. Standard of living. Education. Occupation. Income. Low income causing malnutrition. 5. Socio-cultural factors. Family traditions. Lifestyle patterns. Cultural norms. Family neglecting preventive check UPS. 6. Health services. Availability. Accessibility. Affordability. Limited access to health care in rural areas. 7. Public policies. Government programs. Health education campaigns. Anti-smoking awareness programs. 8. Social support network. Friends. Family. Community. Strong family support improving patient recovery. Internal factors. Internal factors refer to the elements within an individual's control or that affect their perception of health. These factors include biological, psychological, cognitive, and spiritual influences. Biological factors. Genetic makeup. Genetic inheritance determines predisposition to various health conditions, such as chromosomal abnormalities and metabolic disorders. Age. The susceptibility to certain diseases varies with age. For example, infants may be more susceptible to respiratory infections, while the elderly may face conditions like presbyopia. Gender. Some diseases are more prevalent in one gender. For instance, males are at higher risk for cardiovascular diseases, while females are more likely to develop osteoporosis. Ethnic origin/race. Genetic and cultural differences can influence health outcomes, with certain ethnic groups being more prone to specific conditions, such as sickle cell anemia in African populations or skin cancer in Caucasians. Developmental stage. As individuals progress through different life stages, their health needs and vulnerabilities change. For instance, infants lack immunity, and adolescents may engage in risk-taking behaviors. Psychological factors. Mind-body interaction. Emotional stress can lead to physical symptoms, such as a person feeling anxious before a test, resulting in physical manifestations like urinary frequency or gastrointestinal discomfort. Emotional reactions, strong emotions, such as fear or sadness, can affect physical health. For example, someone diagnosed with cancer may experience emotional distress, which can exacerbate physical symptoms. Self-concept, a person's self-image and their attitude toward their health can influence their behavior. For instance, someone with an eating disorder may refuse necessary nutrients despite having a healthy weight. Cognitive and intellectual factors. A person's understanding of health and illness is shaped by education, knowledge, and previous experiences. Misconceptions about health can lead to poor health decisions, such as someone with diabetes continuing to make unhealthy dietary choices despite knowing the risks. Spiritual factors. Spiritual beliefs shape how individuals cope with illness and health challenges. Some religious beliefs may prohibit certain medical treatments, such as blood transfusions in Jehovah's Witnesses. External factors. External factors refer to circumstances that individuals cannot control but still significantly influence their health. These include physical, biological, psychosocial, and socio-cultural factors. Physical environment. Environmental factors such as pollution, poor sanitation, and exposure to toxins can negatively impact health. For example, living in areas with poor air quality or unsafe drinking water can lead to respiratory and waterborne diseases. Biological environment. Exposure to infectious agents, such as viruses, bacteria, and fungi, can cause diseases. Environmental factors that harbor such agents, like contaminated food or water, increase the risk of infections. Psychosocial environment. Factors such as marital stability, family support, and work-related stressors can influence one's health behaviors and overall well-being. A supportive social network can help buffer against illness, while chronic stress can increase the risk of disease. Standard of living. Education. People with higher education levels tend to make better health choices, such as eating a balanced diet and exercising regularly. Occupation. Certain jobs expose individuals to hazardous conditions that increase the risk of health problems. For instance, workers in construction or asbestos mining may be at higher risk for lung diseases. Income. People with higher incomes generally have better access to health care, nutritious food, and can afford preventive care. Conversely, those with low income may struggle with accessing these resources and are more prone to health issues. Sociocultural factors. Lifestyle, health practices, such as eating habits, exercise, and coping skills, play a crucial role in maintaining well-being. Individuals who adopt healthier lifestyles are at a lower risk of developing chronic diseases. Family background and practices. Family traditions and health practices, such as the regularity of medical checkups or the type of diet followed, strongly influence individual behaviors. Past experiences. Previous health experiences, such as recovering from an illness or undergoing a surgery, shape how a person perceives and reacts to future health challenges. Healthcare services. Access to quality healthcare and health services plays a critical role in determining health outcomes. Good healthcare systems reduce the incidence of diseases and improve patient recovery. Public policies and interventions. Public health initiatives, such as vaccination programs or smoking cessation campaigns, positively influence community health outcomes by preventing widespread health issues. Social support network. Having a strong social support system of family, friends, and community can significantly enhance a person's ability to cope with illness and improve their mental health. These factors work together to shape the health status and well-being of individuals and communities. By considering both internal and external influences, nurses and healthcare providers can offer more comprehensive care tailored to the needs of each patient.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.